Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center, and we're doing the Ask the Doctor Anything. We do this every Tuesday at 6 o'clock in the evening to 7 o'clock, and this is an opportunity for our patients and our friends and family to get general impressions about how a physician, a medically standard trained allopathic physician with a lot of functional medicine experience. I've been around the functional medicine and its development since I was a child in the 1950s. So I have about 65 plus years of experience in the whole development with my dad in food research. And then our staff here and other clinicians, health providers bring their experience as well. So we have a great amount of resources to share with you. So when you present a question about something, we can give you our impressions, but this is never meant to be personal medical advice or treatment recommendations over the internet. Rather, it's a generalized response to a symptom of complex um, physical situations, that we might be able to improve or prevent or help restore along with standardized therapy with some natural functional medicine advice. And so what we do is we take your questions by the computer. So if you want that, you have to get on our mailing list. That's at tlcdoctors.com. That's plural for doctors, tlcdoctors.com. When you get on there, you'll see a way to put your email in and get on our newsletter. You'll get notification of this every week, and there'll be a link. On that link, you can hit it, and then you can type in the question or area that you would like to try and explore, and then I'll get it this way. Now, I'm not sure I can always get through all these questions. Plus, if you're on live, if you're watching this live, you can get on to the YouTube and type in your questions. I like to go to them first because they're actually sitting here with me doing this. So I'm getting over a little bit of a cold or the allergies. I have a little bit of a raw voice, and we'll go ahead and start now. So if this is valuable to you, please do hit the like button and subscribe and share this with family and friends. And now we'll start with our live questions. We have several already this early evening. Sarah says, hi, I'm 49 years old, a woman with 3 years into menopause. She was recently diagnosed with Hashimoto's. That's an autoimmune thyroid condition. And she says, my thyroid is sluggish, but numbers are within range. Can I reverse Hashimoto's? That's her first question. And then she added, also recently she started hormone replacement therapy, but my body does not absorb progesterone cream. What is the best alternative? I tried oral progesterone, but it messed up digestion. There's many things you can do. Number one, the autoimmune phenomena is exploding all over. Every one of us is being challenged with a food, genetic modification of food, combinations and volume of simple processed foods that have hydrogenated fats and a lot of fructose. And we have all these unregulated, unclinically tested, over-the-counter foods. We have all these shakes that are out there, all these blends. This is a new world, you might say, and it's really not under control. Normally, food was taken in its natural existing whole form, such as eating an apple or eating meat or eating a fish or eating a onion. Instead, now we have so many spices and sources from all over the world that are making these things. We have really lost control of the protection of what's coming into our body in general. So you could get heavy metal contamination from, let's say, any Chinese herbs and stuff and spices and so forth. because they have so many cold power plants and the no control on their gasoline emission either. And they belch out all this material into the environment, and the jet stream brings it across to us over the Pacific, and it dumps on our land here. And they are not required to obey, by the way, any of the world recommendations for environmental protection, whereas our cold power plants are so clean here. Now, you have to realize then their food is contaminated, and they do have, and they suppress the knowledge of many of their children with neurological and developmental disorders from heavy metal contamination from lead and their deaths. So this is very common with all this industrial plants without any environmental protection requirements put upon their manufacturers. But they don't seem to value their population of people in their form of government. So those poor people in China. What I'm getting at, though, in general, is you can buy all kinds of things from their foods, their spices, their teas and herbs, and you'll have contaminants in it. Even here in America, we've allowed the corrupt genetic modification. We have allowed the glyphosation for pesticide, herbicide. We also have the heavy metals that are falling out with our chemtrail, the aluminum contamination. Then we have the explosion of the ability to go to a grocery store where you have all this variety of foods and their concoction of processing and seasonings. So your poor tube from your mouth to your anus is exposed to all this challenge. What I would suggest is our autoimmune phenomena most commonly is associated with thyroid disease. Those would argue that the tissue form and the receptors for thyroid are all over our cells for the metabolism. So there's some molecular mimicry and cross reactivity to this. So when you're irritating your system so badly and stressing it with all this variety to sort out through the gut every day, remember 80% of your immune system lines your gut. So your immune system is trying to figure out what you're eating when you bring it to present to the inner stomach, the intestines for absorption. And do you chew it well enough? Your blood type, if you're a blood type A, in general, you don't digest as well. Uh, so many factors have gone into the extreme variety of stuff we're giving to ourselves to eat. That's why we are trying here to teach a unexciting but very healthy lifestyle of eating a simple one menu day. We've done that for many, many decades. We've been here where we ask you to have a theme for the day for your protein. So meat is your day. Pick a vegetable you have with it. Let's say you cook up broccoli. So you have beef and broccoli day for your breakfast, lunch, and dinner. If you're in intermittent fasting and you're young and you skip your breakfast, then you just have your beef and broccoli for lunch and dinner. If you're over 60, research is showing that you shouldn't be doing skipping your breakfasts. You should be having the breakfast and the lunch and ending eating at 3 o'clock. So the next day you could have chicken and green bean day. And then the third day could be your salmon and asparagus day for all your meals. But you see the media, you've been propagandized and brainwashed into thinking you're supposed to use this whole for entertainment, that every time you open it up, it's got to have something exciting, fun, social, and something you can take a picture of on an Instagram and send it to everybody. This is designed to help facilitate repairing your body and keeping you alive and healthy and thinking well. It's not meant to be an entertainment hole. So please get that propaganda out of your brain. Start eating a simplified spices. And when you intend to have a day of celebration and you include food to be incorporated in that celebration, then you can truly appreciate the taste and the variety that is available out there. But for the mainstay of your life, please eat a simple one menu day. I know women were not cooking different kinds of meals for breakfast, lunch, and dinner and snacks and desserts. For the most part, if the husband, caught a deer, you're going to have deer coming out your ears until that whole deer is eaten up and the seasonal vegetable at that time. And so people always ate a simple one menu day. So the less stress you put on your digestion, the healthier, the longer, the better repaired your body will be. Um, Now, that for the thyroiditis, if we start taking care of the gut lining here, that'll go a long way to reduce it. And I will tell my patients, be a carnivore for 3 months, and I'll repeat their thyroid peroxidase antibodies, their thyroglobulin antibodies, and I always see it improve. Now, if they're lying to me and they're only 60% carnivore or 75% carnivore, it won't be as dramatic, but it certainly will help. But a pure carnivore diet gets a lot of this pesticide, herbicide, fungicide out. Of course, if you're eating free range sources wild caught, because if you're buying cows that are corrupted by FDA regulated stockyards and they're feeding them grains, then you're going to have problems with that meat picking up some of the pesticide, herbicide, antibiotics, hormones, and so forth. So regarding progesterone, you could try sublingual drops of progesterone. You could have that compounded and ask your primary care doctor to order progesterone. And I would put it, something like 20 milligrams per milliliter or half milliliter. And then if you take two or a full milliliter of progesterone, you're going to get 50 milligrams of progesterone. And then you can titrate up or down and take it at night. It should help you sleep, and it'll be absorbed right through your mucous membranes. Hopefully that'll help you, Sarah. Then Tiziana, hi Tiziana, says, hi Dr. E, I have a biochemistry question. Let's see if I can help. I notice that the systemic and the digestive enzymes are very similar compounds. What makes them act differently other than taken on an empty stomach or with food? The reason is enzymes are exactly that. They are acting to help chew up proteins or chew up fats or chew up your carbohydrate complex branch chain type of amino acids and sugars. So these enzymes are the job that does it. It's the biochemical name of something that hydrolyzes or chops up all these connections between the carbon bonds. Now, when you take it with your meal, you're focusing all that on what you just ate. When you take it without food, it's absorbed into your body, gets down lower in your gut, and is absorbed into your body for your joints and inflammation in your body from your scalp to your toe. The other thing that's more unique about digestive enzymes is they will add betaine hydrochloric acid. So typically, betaine hydrochloric acid is in any enzyme for digestion to be taken with foods, whereas it's omitted from systemic enzymes to try and be absorbed further down the GI tract. That's why Vitalzyme puts it in these resistant from digestion capsules that are thick, so it'll make it its way further down into the gut and absorbed into the body. So I talk all day, so I'm getting this laryngitis or cold or allergies. So excuse me, I have to sip some warm fluid. This is called Live Real Healthcare at Tustin Longevity Center. You get the real deal, nothing fake. And I just got back from my workout in the gym with my husband for lifting weights, so I'm in my gym clothes. All right, then Beth says, I would like your recommendations for pelvic congestion for a 57-year-old woman, not overweight, that had 2 children. Beth, that means you're going to have to get a relationship with a functional doctor who maybe can help you with doing pelvic exams. You're going to have to drink enough water because we need to help rinse away uh, old age damaged cells. So we dissolve it into water. So you've got to drink that water. And we tell you to drink half your weight in pounds as ounces of water every day. I asked you to drink filtered water. And then we ask you to take systemic enzymes, just like Tiziana was asking before. Tiziana was talking about systemic enzymes versus digestive. In your case, we would want you to use systemic. I would use a high dose. I would use 5 or 6 twice a day, maybe even 3 times a day on an empty stomach. It may take 4 or 5 days before you start really feel the full lift, you might say, of the what is called pelvic congestion. The other thing is, I would suggest, Beth, at 57, I don't know if you're on hormones or not, but all women who are on natural hormones, I require all my patients to take systemic enzymes so they don't get congested or other problems. Then I would ask you to be on a low carb diet, an extremely low carb diet. I would ask you primarily to eat a 1 menu day, select the protein for all your 3 meals, and a cooked vegetable with butter, salt, and pepper. So that if these are aggravated by food, lectins, allergies, you greatly reduce it by narrowing down what you're going to eat for your 3 meals a day. Intermittent fasting would help. So if you could cut off either the breakfast or the dinner, that helps. Definitely, we do not want you to eat late. If you're near 60 years old, I would try not eating dinners or stopping eating by 3 p.m. Find out what your blood type is. If you're a blood type A, you may also need the digestive enzyme when you eat your food. But the older you get, and I think I was around 58, 59 when I'm a B type blood, and I started to need digestive enzymes even to help me digest my food, to get rid of the body inflammation and congestion that I was having. So those are some suggestions I would give you. Perry says, what a great question, Tiziana. Dr. E was Dr. McCollis. Oh, Nicholas Gonzalez into various enzymes. I'm not sure if I'm reading your statement, Perry Lynn, correct. Was Dr. Nicholas Gonzalez into various enzymes? Oh, I think I know what you're referring to. This was a doctor, yeah, on the East Coast. I think he was in New York City for a long time. He used high dose systemic enzymes, and he was treating pancreatic cancers with it to help the pancreas to disinflame itself. And he had a lot of amazing improvements and actual turnarounds in some of these cancers. I do recall he was using somewhere in the realm of 60 enzymes a day. So that those people must have been taking like 10, every hour or 2 hours while awake on an empty stomach, or as empty as they could keep it. But yeah, that Nicholas Gonzalez was the medical doctor who had to move his practice to St. John Island or the Bahamas to continue his wonderful research and work. And that's the problem with the mafia and the that we have, the criminal syndicate that runs medicine, runs the educational training in medicine, and runs the funding for it and the licensing. We need to get rid of this centralized control, stranglehold on wonderful creative doctors looking for ways to help their dear patients, because there are some very good doctors. and that ability for them with their mind and their creativity, as long as they do no harm. Now, you have, and everyone has, the lawful ability to bring to court any doctor for being harmed by them. And you don't have to have a centralized government for them. And usually, doctors who are good are in one place, they're not moving around, and they're there for decades, and they develop a reputation, and it becomes known by the people whether or not that's a good doctor and a helpful doctor. So you start to realize people are trying to hide themselves and what they stand for and believe and do. These are people you need to be fearful of and watch. So transparency and localized control is what you need, not these centralized national and state boards that are terrorizing physicians and hurting the population with small-minded, power-hungry bureaucrats. A lot of people give up the practice of their nursing or medical practice just to sit on a state or government board and pass the time away getting money and not having to deal with the difficulty. I mean, people are difficult, and sometimes you have to do a pelvic or a rectal exam and stinky things, and you don't want to do this. And hiding in a government job where you're just paper stamping and saying yes to an insurance, you may do this, or no. See, you breed that kind of a problem. And I like to tell the story about when I was in medical school in the 1970s. Not everyone had insurance, and not all the doctors used insurance. And in Chicago, the guy who I studied under as a mentor in family practice, he was in northern Chicago in the, boy, I don't know the names of the areas there, but it was north of the John Hancock building, north of that up on Lakeshore Drive, but it wasn't by Northwestern University. Anyway, he had a private practice there, and it was only dollars to see him for a follow-up, and a new patient would be $7 or $10. So he didn't take insurance, and it was just amazing. And the Christian foundational hospitals, there were so many there. Many of them didn't take insurance, and people were helped. And the community saw these as pillars for moral examples to the community. Anyway, the point was, your question is, Nicholas Gonzalez and these enzymes. So he's one of the great ones. I don't think he's living anymore, but he was a man who was getting value, and his research should have been made available so many other people could have learned about enzymes and helped so many other people. Well, fortunately, we who did this, including Dr. Gonzalez, Dr. Whitaker, Dr. Omura in Japan, Dr. Klinghardt, all these kind of doctors, they stayed with us. They created the foundation for functional medicine, and that's the blessing we have today. Okay, Perry Lynn says, yeah, that's him. Okay, so I did get the right one. He was given a grant from NIH to study pancreatic cancer, and then he died. Yeah. And Suzanne Summers, she did try and connect with him. All right, so that's kind of the story on that. Let's go to some of these over the email questions. The few I didn't get to last week, I'll start with today. I have 5 of them. One is Ariel says, I'm feeling a lot of fatigue lately. Should I be doing a parasite cleanse? If so, can I get fenbendazole or ivermectin? What do you recommend for body parasites? Is there a brand you recommend or can prescribe? Ariel, we are at the behest of a propaganda machine. And I am not all-knowing. I am not God. What I'm telling you is my sincere 44 years of practice experience. And that's the best I can do. Of course, I can do my continuing medical education and, keep studying every day on my own. But you have to understand people make money selling stuff. And there's nothing that ruins a man's moral conviction or a woman's moral conviction any quicker than offering money. And if you are said to take something and your friend's taking it and they feel better and their friend's friend is taking it and all 10 of them are better, and you ask them what was it and what is it for, and they say it was for parasites. Don't you know everybody's got parasites now? Then you have to understand, um, this is the new flavor of ice cream of the month. um, I am not against the knowledge that there is a ruined immune system from the corruption of our corrupt government, education, medical system, pharmaceutical, and our food industries, and down the line it goes. There's no doubt that we're hurting ourselves with these carbs and fruit sugars and eating too late and too much variety. And that will allow more infections of all nature. But all I can tell you is I did a second doctorate in integrative medicine back in the 1990s, long before many of you were even out of grammar school. And this I did because I knew there was danger in River City or something rotten smelling in Denmark, as the statement goes. I knew the medical system was corrupt. And so I've been studying and following this research for many decades and decades. And I know of the underlying theory of the pleomorphic state of the environ or the infectious agent, whatever they call it. I know of Tom Cowens and his research with other great men of science doubting the even existence of viruses. The underlying underling theory is that a bacteria can turn into a fungus and can turn into a parasite, have pleomorphic different forms. And science needs to be open about its limitations. How many of you had a PCR test to claim you had COVID? How many of you had a viral swab and they grew out the SARS-CoV-2 virus? None of you had that done. You just believed them when they said they swabbed you with a PCR or an antigen swab and you turned up positive or negative on the test. So you see, we just go with the flow and we believe the flavor of the month ice cream disease. So it's too hard to take the personal responsibility to drink enough water, get a good night's sleep, exercise regularly, lower the processed foods, increase the grass-fed foods, eat a more simplistic menu, add digestive enzymes. Those of us who are older, over 60, probably need it, all of us. Find out your blood type. If you're an A, you'll need digestive support from childhood on. And then we have ruined this topsoil so much that we don't have the nutrient density that we used to have. So if you do the USDA food value research that's put out every so many 5 years, and you look at the nutrient density of an orange today compared to one back in 1950, we're less than half the nutrient density. So we have to take some supplementation. But then everyone's selling a supplement. Now everyone's selling antiparasitics. You can't let yourself live in fear and be blown around like this. We have lived very well, washing our hands, blowing our noses, throwing away dirty towels and tissues, flushing our toilet into a septic tank, and sanitation has done more to stop viral illnesses and epidemics. So your plumber, your carpenter, your waste management men have done more to keep our society and people healthy than any doctor has. That means God is good when he was teaching in the Bibles about the rinsing of the utensils and not eating anything past 2 days as an abomination. So it's very interesting to see the hygiene recommendations of the Bible, and it will keep you healthy. So don't worry about parasites, is my point. Now, is there some revelation that the multifaceted mechanism to kill parasites seems to have been found to kill cells that rapidly replicate, especially in solid tumors, like with fenbendazole, menbendazole? I think there's another one called iatrazole. That's an old antiviral medicine. Ivermectin as well. Now, they're seeing these things, and I'm interested, and I am studying my little brains out as much as I can every day of my life, every week, every month, every year of my life for the benefit of my patients. I am not an oncologist. I don't treat cancers, but I want to be informed about what is coming through the chat boxes and what people are finding as anecdotal cases for a count of one. But when you start seeing hundreds, dozens worldwide responding with solid tumor stories that have remissions on these anti-parasitic medications, you have to do study. So don't become a doctor or a nurse or anything if you're not going to resign yourself to being a student all the days of your life. So I am not going to tell people, oh, you're tired? Now let's start selling you antiparasitics, okay? So I'm just not going to do that. Especially if you're not drinking enough water, especially if you're eating too late, especially if you're not exercising, especially if you're not already working on the carbs. You work on those things first and find out your blood type. Now, incidentally, this is what I am looking at, and this is the one I have vetted. I have looked into the manufacturers, and I have looked into the dosing. This is put out by Mahoney, Mahoney. And I got this for myself because I'm studying it. I'm not recommending it to anybody. I am learning about it. But I know you guys are going to be looking at things, so I'm trying to stay ahead of you and do the research. So this is the only viable company I have found. And they put in on the back, the contents proudly are listed as fenbendazole 222. It's available over the counter in our country, and ivermectin 12 milligrams in 3 capsules. I have patients coming to me who are using fenbendazole and ivermectin, and they have cancers, and they are end stage, and they started using this, and I am seeing some very amazing turnarounds. So obviously, I'm going to be looking into this. I'm not going to treat or recommend it because I'm not an oncologist. That's for the oncologist to do. But I know all you patients are going to be asking me, so I am studying about this. And this is the only one that I have found from Mahoney Industry, Mahoney. They put out other products, and their Paragon has just the fenbendazole and ivermectin. So they're no fluff. They're not trying to upmarket it and get just, clickbait for you to get it. But the dose seems to be double what they put out there. I'm finding more patients needing 444 in their regimens and 24 milligrams in their ivermectin. And you have to have a doctor who is helping you to look at your blood count, your CBC, complete blood count, and your liver enzymes if you're going to do something like that. So I'm trying to be informed, but I am not in a position where I'm going to recommend that at this time. But I do know people are doing it, and it appears to be safe and effective. I had one patient who self-medicated himself with fenbendazole, and I think he was somewhere between 222 and 444 milligrams, and he was doing it, I I think, continuously rather than on a cycle of, 3 days on, 4 days off, 3 days on, 4 days off. Now, I'm not recommending that. I'm just saying these are what I see in most of the people who are talking about it. We don't have the answers. There needs to be funding and studies on this. But out of that scenario, he decided to use it every day, and he wound up suppressing his production of blood from his bone marrow. Now, he came back, but he did require transfusions, so he stopped it for about 6 weeks, and I think he got back on it. But I'm using this as a template to tell you your doctor needs to stay informed. Your doctor needs to warn you that this is not studied. The companies that are producing it, we do the best we can to vet. The only one I have found, Mahoney's source, seems to be viable, but I didn't fly out there. Normally, I go and fly out there and look at these companies because I was a chemistry major. But this Paragon by Mahoney Industry seems to be the most frank, clear cut forward with what it has and what it is making available out of the over-the-counter industry. So that's what I'm dealing with. So no, I don't think everything is a parasite, and fatigue is certainly not to be considered you need a cleanse. I'm not even in favor of these concepts of doing a week or 2 week cleanses. I know Juice Plus has a cleanse. Many companies have these cleanses. I'd rather you do the hard work of eating a one menu day where you just have a beef and broccoli day, the next day a salmon and asparagus day, next day would be a chicken and green bean day, butter and salt and pepper as your seasoners, and rotate that for 2 weeks and stop eating by 3 o'clock. Drink your half your weight as ounces every day and exercise, and that's a cleanse. Okay, so I'm not for selling gimmickry powders and gimmickry material without research. I've seen far more benefit from just real life, humble doing what's right. Get out there and stand in the wet grass, earth yourself, grounding at sunrise when the sun's coming up, barefoot in the wet grass, or stand on the wet sandy beach with the waves hitting your feet for 2-3 minutes and get grounded. All right, the next question, Lynn, I have started taking your proven MD systemic enzymes, but I saw it doesn't contain serrapeptase. Yes, it does. So it does have it in there. And what it does is, you probably saw the bromelain number, and it had in parentheses a subcomponent, the serrapeptase. So it is in there, Lynn. I am trying to get these Morton's neuroma on my feet to go away. Any more suggestions? I appreciate your show so much and listen often. Many thanks. God bless you. Well, blessings, Lynn. It is in there. I would make sure that I'm not eating late, and I'm very low carb for your Morton's neuroma. And I would have, supportive shoes that allow your feet to spread out. Usually a Morton's neuroma is in the joint where the nerve and the blood vessel between, each of these places, they branch, and the squeezing here with every step creates an irritation at the branch point of the vessels, and they're a little bigger and they get pinched and you get sore. So you have to cut out the sugar, cut out the processed food, stop eating late, maybe trying to take a fast for 24 to 48 hours on 2 consecutive days, take a lot of enzymes and see if you feel better, and just have to clean your life up like that. Elizabeth says, is there a safety difference between compounded bioidentical hormone replacement therapy and FDA-approved bioidentical hormone replacement therapy? Well, I don't respect the FDA, so yeah, there's a big difference. I was cautioned by a physician not to use compounded. Well, I don't think he sounds very intelligent then, if he's claiming to be a physician. We have to Be personally responsible. Look at the buck ends with you. The buck stops with you. If a physician is harming you, they have to be held accountable. You have to have the strength to take them to court and prove that you were harmed or put at risk by them. This will make physicians work harder, study harder, and value their patients. There is no perfect physician and there's no perfect patient. We're trying all the time to do what's right and not harm anyone. But now, without, I'm sorry, my opinion is as a worldview that the Bible, have a Christian worldview of everything I do, and my work as a Christian, I'm trying to do it to bring honor to God. But so many people don't believe in God, young doctors today, and they see you as a substance of a collection of molecules, a biological entity, and they will do, respectful, courteous things, but they don't have the empathy, compassion. They don't believe in a life hereafter. They're as scared as anyone who has no hope about death, dying, and picking up a disease from you. That's why they all shut up during COVID and close their windows and their doors and put masks on and everything. Where I worked more, and I'm in my 70s. I went to work 6 days a week. I hugged everybody, didn't put a mask on, and none of my patients got harmed nor needed hospitalization because we were bold enough to stand on our convictions that God hasn't failed us. We are to be social. We are to shake hands and smile and let you see our face and see you one-on-one. And there's great health and healing in our touch and our being present. So the FDA can go jump in a lake, and physicians who say compounded hormone replacement therapy has dangers. Well, it's the FDA that has approved, the Food and Drug Administration, all this junk food with a dye in it associated with cancer that you're giving to your children that they're just now taking out of the food that are harming our children. So don't tell me the FDA is holy or good. It's full of people who found a ticket on a government ride with a usual landing site as a consultant in some corrupt pharmaceutical food industry lobbyist, and they don't have to account for anything, and they'll get their 7 figures of income if they just shut up. So I love my patients as best as I can. Of course, God loves you perfectly, but I at least recognize that you're his creation, and I have to try to do my best to take the best care of you. So that's a long statement saying, no, there's better safety in a compounding bioidentical hormone replacement shop, because that sincere pharmacist is so convinced that he can help people even more than some pill shipping industry that he just doses out and counts out, that he has a brain and he can be protective of you and help you with his knowledge on pharmacy and chemistry. You have much more personal accountability with a personal compounding physician than you do with any silly Walgreens, CVS, Rite Aid type of pharmacist who is just looking at you as a paycheck. That's my experience. I just found the most loving, thoughtful, caring pharmacists are compounding people, more intelligent. And that means more safe. Debbie says, thank you, Dr. Ellithorpe, for all your wisdom and knowledge and experience you give us weekly. I give you my opinions, don't I? I'm sorry. I don't want to bring anything disparaging to my Lord and Savior, but your thoughts, please, on the cautions of high dosing of fish oil and the connection to developing atrial fibrillation. Well, that is a connection. I don't think it's been well studied, but yes, some people, and you dear people, have seen the corruption in the standard allopathic non-caring scenario and Just by the way, do you know that Dr. Fauci's wife is not a medical doctor, but she's a bioethicist? And she's the one who approved of all this stuff, giving that mRNA injection to infants. And she's a bioethicist. Don't tell me you can legislate morality. If you don't have, like our forefathers said, John Adams, I believe it was, who said, this constitutional republic that we have just given you is meant for a moral people, a people who are adults who self-control themselves. It's not made for opportunistic people who do not have God. But where was I yet on that? You were talking about, you know, FDA and bioethicists. So there isn't enough enough time in a day for me to tell you all that's wrong with fish oil. Fish oil is meant for fish. DHA is a 6-carbon. EPA is a 5 double bond carbon fatty acid chain. They are very stinky when they combine with oxygen and become rancid or oxidized. They burn fast. God put more double bonds in fish because fish swim in cold water, and he didn't want their metabolism and their body to freeze. You and I live at 98.6 degrees and higher environments of temperature. We only need 2 and 3 double bonds at most with linoleic and alpha linoleic. And it has been well proven if you eat enough meat, fish, chicken, turkey, beef, chicken with the skin on it, eggs, egg yolks, some nuts and seeds, you're going to get all the linoleic and alpha linoleic acid that you need. So you don't need to buy fish oil. I'm against that. There's a whole corrupt story that could be told of the corruption of McGowan's commission on the cholesterol hypothesis for heart disease in the late 1970s, early 80s, and how the vegetarian Loma Linda, I think it was Seventh-day Adventist vegan type people had a undue influence in running that committee and throwing out all the wonderful, healthy scientific literature on natural animal-based fats. And that's where we got all the trans fatty acids, the seed oils. You can thank the vegetarian, vegan, these religious organizations that tell you not to eat these animals. You can thank them for much of our disease as well. So you can't legislate science and healthcare. It has to be one-on-one accountability and let each one individual. Remember, our Constitution was meant for individuals. It wasn't a state. It was meant to be acknowledging the right of the individual came from God, not any state or crown or nobility. So you have to understand they felt that each one of us, wherever we lived in the nation, we would study, we would think, and if someone was harming someone, we would take them to law. And then we would have to prove it, of course. And that's how people would mind their P's and Q's and try and do the best they could to do no harm. But when you hide under cloaks and titles of nobility and black robes, then there is no safety at all, not even for our children. And now you see all the harm that has been done to our population because of what we let happen through the mRNA injections. Okay, now, so don't worry about these fish oils. Terry says, are you familiar with the results of OsteoStrong and biodensity for bone building? For a 77-year-old female with osteoporosis? Well, I have all kinds of females with normal bone densities who are in their 70s, 80s, and now 100-year-olds. And they don't need this OsteoStrong activity. You need to go right over to your little YMCA gym where the machines are, not free weights. I'm not for free weights because if you aren't an expert in using them, you're going to hurt yourself. So get on the machine where you're put in position, put in the pin resistance that you can handle, and you do your slow motion, whatever the motion is, or whatever action you're doing, or leg pushing, slow control, and you will get that bone stimulation that will make your bones grow. Plus, you'll get the muscle workout. That osteostrong, don't tell me once a week, 10 minutes is going to make your muscles grow. They've got to show me that paperwork. Now, I'm going to buy that they're going to get some bone stimulation because they're putting intense resistance, and they have these computers saying you've done 200% of your body weight or 300% of your body weight moved in this resistance motion, or their vibration plates. I'm not going to argue that, but don't tell me they're muscles. They have to show me body mass scans to show me the muscle mass that goes up with it. So I would rather see you go to the gym at the YMCA, 24-hour fitness, LA Fitness, the Crunch, and get on those machines where you put the pins in and do 7 machines. One would be the Crunch for your whole spine. The other would be the chest press. The other would be the pull. I forget what those, your lats in the back pull, making your shoulder blades kiss. That's 3. Doing the pull downs for your trapezius and lats, upper lats, and then do the leg press and the leg extension and the leg flexion. Those are 7 machines that you could do, and that'll really build up your muscle mass. Of course, you have to eat the protein. Of course, you should use digestive enzymes. Of course, you should not eat late, and that will all help you. So no, I don't like osteostrong or biodensity. And then I have all these women, including that 100-year-old who had her birthday party. She's on her bioidentical hormones, and I get their vitamin D levels up to 100, 120. And then they do very well. So find a good functional doctor who will do that with you, Terry. Pamela says, can you please tell me about multiple myeloma? Well, multiple myeloma is a type of cancer. Usually it is associated with a long prognosis of you'll 40 to 80% life expectancy, I think, after a diagnosis. So many people live with it a long time, and it's treated with chemotherapy, immunotherapy, and then there are many functional therapies. I would try and find a functional doctor who could talk to you about, and functional medicine is the one that really got into developing enzymatic therapies and immunotherapies to target tumor cells. So it's all functional medicine the past 50 years that has been doing it. And so many of us doctors who have done it, I'm happy to see the industry trying to make money on monoclonal therapies and other antibody therapies, and they are starting to show some promise. But let's give credit where it's due. It was all the old functional doctors that was thinking outside of the box beyond just the cell destruction of chemo, radiation, and surgery. But I think it has usually a very good outcome, but you should work in concert with a functional doctor who will help build up your immune system. Because remember, they're trying to boost your immune system with monoclonal antibodies and immunotherapies. They want to boost your immune system to help target multiple myeloma tumor cells and identify them so your enzymes and your killer cells can eat them up. So work with someone who will do that. But it typically has a good prognosis. Marlise says, my 37-year-old son has had some recent disturbing issues. First, he experienced alopecia barbarae. That means he's losing patches of skin where his beard would normally show up nicely. And then he got shingles. Do you have any insight into what may be going on? Yeah, it's an autoimmune phenomena, and it's from the lousy diet, the pollution, even the electromagnetic energy waves, 5G potentially, 6G they're talking about, the lack of healthy exposure to light, the lack of having a good dark room for sleep. And so all these things are having an impact. You should find out your son's blood type. You should find out what his fasting insulin is. He shouldn't be higher than a 4, at most a 5. You should find his fasting blood sugar, shouldn't be any higher than 85. And then do his HOMA IR, which is his homeostatic stasis insulin resistance number. If it is over 1, so let's say his blood sugar is 100 and his insulin's 5. 5 times 100 is 500. You divide that by 405, and that'll go in 1.3 times or 1.2.8 times. And he'll have insulin resistance, which is the precursor for more diseases, more cell damage, more autoimmune cancers, mental diseases, dementia, all these neurological problems as well. Find a good functional doctor who will find out his blood type, do his fasting insulin, fasting blood sugar, fasting triglyceride on a lipid panel, hemoglobin A1C, homocysteine level, testosterone level, estradiol level, PSA, complete blood count, complete chemistry, do his free T3, free T4, thyroid stimulating hormone, do his thyroid antibodies. I mean, a good study on him, and start getting him to gym and water and working out, and the body will tend to disinflame, and then maybe he'll get hair to grow back there. Betty says, hello, is it true that hyperpigmentation is caused by high levels of cortisol? No, it's usually low levels. Addison's disease has low cortisol because the autoimmune phenomena of Addison's disease is the attack on the adrenals, and you have low cortisol and you get hyperpigmentation because it messes up the hypothalamic pituitary axis, and more melatonin is stimulated that way. So what you have to do is find a good functional doctor who knows to look into the cortisol and your gut health. Vanessa says, are there any natural remedies for tinnitus? Thank you. The answer is do all the healthy things I'm telling you so you'll have a healthier body overall. I am sick and tired of all these times I have to wait on this internet. When I do internet work, something will pop up as an advertisement. Now everyone should be doing special tinnitus studies with certain water bottles or cups over their ears, and it always turns into you have to buy a certain supplement to help you get better results. This is marketing, people. You have to get off of this. Put your effort into drinking water every day, getting a good night's sleep, shutting off your electronics, get your light therapy under control, get up in the morning with the sunrise, ground yourself, eat a simplistic 1 menu day, low carb, exercise, weight train. That's what we need to do. And take systemic enzymes, or if you need them. So Vanessa, find a good functional doctor who will help you in that. Nancy says, how do you control pain with chronic resistant pain syndrome without taking drugs and scramble your brain? Nancy, you got to find a good functional doctor that's going to work with you. Maybe you'll need a pain specialist so that your functional doctor and your pain specialist can work together to help you. But you have to put many parameters of standard medicine and lifestyle changes together, and nutrient dietary changes to help you get better outcomes. John says, have you learned much about allulose as a sweetener to recommend it or discourage it? I do like allulose, and I do have allulose. I have monk fruit and allulose. If I'm going to make anything like for my grandkids, I'm going to have some, make a little treat for them, I'm going to use allulose or monk fruit as a sweetener, but that's pretty rare for me. Pretty much like on Sunday, I sent over to my son's home and his wife and family, instead of a cake or cookies, Grandma sent over a slow roasted, healthy chuck roast, a piece of meat. There you go. How boring is this, Grandma? I'm a meat eating, almost carnivore grandma all the time. All right. Sherry says, "Hi, Dr. Rita. I know you do weights a few times a week, 3 times a week, and I'm 65 years old and wanted to know how many reps do you do and how many do you do? How long would you say you're in the gym? I always get hurt with free weights." I kind of referred to that earlier. Essentially, I am for using machine weights only, never free weights. I am for getting a resistance that is an effort for you and controlling it both in the action and retraction of every movement, whether it's the pulling down and slowly going up. Any action has to be slow and controlled. And then you're at a safe weight and a controllable weight. So you don't suddenly lose it and jerk away and rip a tendon as we get older. So, how many reps do I do? I do 2 sets of 20 reps, but I worked at it. I don't know, years ago. How many years? 5 years ago, I started doing the perfect workout 2, 3 times a week. And then I said, why am I spending all that money? I know how to do it now. So I'll just go to the gym at Crunch across the street here from where my office is. So I get a lot of time to work out there. And I've worked up from I could only do 4 chest presses against the number one. I'm still on number one, but I only could do about 4 of them when I was 65. Now I do 40. So, I'm not looking to in the mirror. I don't care what I look like other than healthy. That's what I want to do. Inspiring, lifting up to my Lord, and healthy. So I know my muscle mass has gone up because I can do a body mass BMI here and I can see it go up and my fat content go down. And I guess that's all I can say about it. I'm there for a half an hour. I do it 3 times a week, and I take a mile or 2 walk most every day with my dog. And that's what I do. Chuck says, how is it that at 65, the blood pressure normally these days is 120/80 with all the food additives? How is it that the only way to achieve this would be to take blood pressure pills? Wasn't it a bit higher in the 80s? What are the alternative things? Yeah, it used to be 140/90 back then. Yeah, but you can sell more, make more money if you lower your standards, for thresholds. Look, I just had, January 31st, I had a tooth pulled, had surgery. And during the surgery, the oral surgeon said, I have never seen somebody with such a low blood pressure at your age of 70 so, and you're like a teenager. So I'm on no prescription medicines. I take my natural hormones. So if you drink your water, you do your exercise, you get a good night's sleep, you use your salt to taste, you eat humbly, and you just enjoy your environment, I think you're going to do well. There's no miracle. I do take a multi-mineral that has magnesium, potassium, selenium in it. I do take a B complex. I take my enzymes. I take iodine. I take my clinician's preference oil, which is the linoleic alpha linoleic acid. I take what else? The seasonal shield for my quercetin. I take my systemic enzymes, my digestive enzymes. I take a DHEA 50 milligrams. What else? Right. I take my Juice Plus, of course, my green, red, and purple capsules. And I take a probiotic. And I do take vitamin C capsules, buffered C. But you can have normal blood pressures, 100/60, 110/70. That's what I ran during all the surgery. So, and I didn't let them knock me out for it. It was just, I think she prepped me with a little ketamine or something. I don't know. And local. All right. So it's after 7. I got to stop. And I've enjoyed this. Let's see. I didn't get to Amela. After a colonoscopy, you should be able to, Amela, take anything you want. Annetta, hydrating facial serum, important to keep my face moisturized. Eat a simple diet, low carb, and take estradiol. I put estradiol to my face, helps collagen elastin. I take my vitamin C, that helps the hyaluronic acid So I don't do anything fancy. Uh, will a 72 or 100-hour water fast help put cancer into remission? That has been looked at, and there's a lot of science that is saying starving the mitochondria of the tumor rapidly growing cell, it needs to eat a lot of sugar to grow. So if you do a 3-day fast, water fast, yeah. So the science looks very promising, specifically a sarcoma. Yeah. But I know that there was a bone cancer, a sarcoma guy who used the fenbendazole, I think it was. I know there's a lot of veterinary medicine that is reporting the use of these antiparasitics. What they do is there's many levels with these antiparasitics that interrupt cell structure and building of a cell. So the microtubular tubules of a cell are destroyed, so it can't divide. The instructional transcription is injured with anti-parasitic medicines. So there's about 6 different pathways. There's a guy by the name of Dr. Casey Peavler, Peavler. I think you'll like him. He's young, he's sharp with the computer. I'm in my 70s, so I was not into that YouTube, FaceTime picture, Instagram. I'm not on any of that social media. But he has all these wonderful videos on all these issues of starving of cancer, fenbendazole, ivermectin, quercetin, melatonin, vitamin D, berberine, sulfa. What is the other one? Sulfasolamine. All these things for cancer, and he goes a deep dive into the research papers on it. So Casey Peavler, P as in Peter, Eavler, Casey Peavler, MD. Check out his work and his page. All right, so good night, everyone. See you next week. Like and subscribe. Please like and subscribe and help us grow. All right, take care. God bless.